This is day 15 post-op video routine nasal endoscopy of the patient. This was a patient of AFRS, allergic fungal sinusitis. So as you can see, I'm on the patient's right side, and you can see I'm using my suction in the patient's right side nasal cavity, trying to move the secretions, cheesy pus secretion, and a lot of nasal scab formation which had collected in the anterior nair area. So this was a patient of AFRS and started on severe, vigorous nasal washes, but still the patient landed up with severe crusting in the anterior aspect and a lot of mucoid entrapment inside. So as you can see, I'm just trying to remove all that scab formation, the crusting. So the surgical video of this patient is also there on my YouTube channel, and this is day 15 of that patient. You can see this is the patient's right side maxillary sinus. You can see all that pus collection inside because of the entrapment caused by all that scab. You can see that's the area of the posterior end of the middle turbinate. We had done the resection of the middle turbinate as well to have a good post-op space for nasal washes, the steroid nasal washes. You can see. So what I'm going to do is I'm going to take away all that scab slowly, making sure I do not injure any mucosa and form any raw surface again. So just gently with the suction, I'm gonna try to elevate that off the mucosal surface. As you can see, it's coming off in pieces, and a very small raw surface is being formed again because of the separation of the scab. So I'm taking my curved suction and trying to give a thorough steroid nasal wash inside the sinus. You can see how big of an opening we have achieved in this patient's right side maxillary sinus. So I'm going to suction that again. So whatever washes I'm doing, so we're supposed to give thorough, constant steroidal washes. I'm using Ringer's lactate, 500 ml of Ringer's lactate mixed with 4 to 5 respules of budesonide, 0.25 mg budesonide. You can see all that crust and scab and fungal debris coming out. So this patient had a very severe load. So I'm just trying to show you in this video, if any surgeon out there is trying to perform a surgery of AFRs, how to maintain and take care of the patient post-op. So now I'm shifting onto the 70-degree endoscope and I'm trying to show you the patient's frontal sinus opening. As you can see, that's the patient's frontal sinus opening. Now, if you've seen the surgical video, at the end of the surgical video, I had managed to open the patient's frontal sinus. You can see it's a very huge frontal sinus opening, and this patient had a very boggy edematous mucosa, for which I started the patient on steroid therapy of 21 days with tapering doses, and as a result of which you can see the mucosa has undergone severe reduction in swelling, and you can see a huge opening in the frontal sinus right now. So I'll also show you the pics of the external frontal sinus glow at the very end of this video, but you can see I'm now trying to give a wash in the patient's right side frontal sinus. So this is the maxillary curved suction I can use for both maxilla and frontal sinus wash. You can see now I'll even show you a better way of doing a frontal sinus wash. I'll explain that how you can do that. So now this is 0-degree endoscope, and now what I'm trying to show you is the skull base area. So whatever scab you can see, now that's the sphenoid sinus in which the suction was there right now. And I'm trying to remove the scab right now above the sphenoid sinus. That's the roof of the maxilla, and that's the lamina papyracea right now. I'm trying to remove the scab on. So you gotta use liquid paraffin. You gotta keep giving multiple liquid paraffin washes. So right now the scab is present all over the skull base. So I don't want to take any chance and break the bone on the skull base. So now I'm trying to change the endoscope. So right now I'm going to show you the maxillary sinus with the help of an inverted 70-degree endoscope. Now, if you've seen the video, you must have seen that the maxillary sinus on this patient's right side was severely affected. Now, as you can see, that's the complete 360-degree view of the patient's right side maxillary sinus, anterior, lateral, posterior, superior, roof, all the walls of the maxillary sinus. You can see just with the help of a 70-degree endoscope facing downwards. The most easiest way of examining the most narrow and the blind areas of the maxillary sinus. So you just got to keep the 70-degree endoscope facing downwards and carefully go inside the nasal cavity as I'm doing right now. And there you can see that's the posterior wall, anterior lateral wall right now. That's the most anterior aspect. You can see even the anterior inferior wall of the maxillary sinus along with the roof all in one image. That is a 360 degrees. So now I'm going to show you the second alternate method of giving washes to the frontal sinus. So if you come across a case where you have to open up the frontal sinus, as you can see, that is a 20 cc syringe and that is a 10 number three-way extension cord. So you can cut that to a specific length. It has a natural curve to the tube. So that natural curve which the tube has got to itself is going to help us have an easy access directly in the frontal sinus. So take your 70-degree endoscope just the way I'm using it right now. You can see the three-way is arranged in such a way that the irrigation is going to go directly through the tube. So the natural curve, you just have to insert that tube inside and it's going to take its own course. So as you can see, as you go, the natural curve of the tube is directly going to make the tube go inside the frontal sinus. Can you see that? How beautifully it just entered directly in the frontal sinus without any hesitation. The next step would be to take a upward forceps. You got to make sure you use a 70-degree endoscope very gently, the way I'm using right now. And now you're going to take your upwards Blakeslee, grab hold of the tube and just push it upwards exactly into the depth of the frontal sinus. And now you can ask your assistant to flush normal saline Ringer's lactate mixed with budesonide inside the frontal sinus. Can you see that? So make sure you go for constant washes 2-3 times at a single go, and that's going to take away whatever debris is left behind in the frontal sinus very easily. So you can see it's all clear fluid that is coming out, so there is no sign of any fungal debris inside. So I'm going to take the tube outside now and I'm going to check inside. You can see the roof of the sinus very clearly, and now I'm going to give a wash under vision. You can see all that fluid coming up and then going down. So the sinus is completely clear, and I also achieved a very huge frontal glow, the Friedman sign, the photo of which I'm going to show you at the very end of it. So the maxillary sinus, frontal sinus, both the sinuses which were mainly involved by the fungus are completely free of fungus right now, 15 days post-op. And whatever scab you can see lying there on the skull base, I'm going to keep it that way and I'm going to keep giving multiple liquid paraffin nasal washes. So once I'm done with my endoscopic nasal wash and I'm satisfied that the patient is free of all the fungus and the debris, I'm going to put a lot of steroidal ointment inside with the help of a 20 cc syringe and a suction cannula. So you can see I'm trying to put Neosporin H ointment, that is an antibiotic, as well as a steroidal ointment. So keep the patient on oral steroid tablets at a tapering dose. Constantly ask the patient to go for nasal washes with steroid solution inside with Ringer's lactate, and call the patient for every 10 days follow-up and clean the nasal and the sinus area under endoscopic vision. So this is how you should follow up for a patient. So I'm going to put the ointment now in the maxillary sinus. So steroid is the main course of treatment in case of AFRS, along with post-op nasal washes throughout for 3 months at least. So that's the external photograph of the patient on day 15 itself after the thorough nasal wash. And as you can see, that's the patient's right side frontal sinus, and we can appreciate a bright reddish hue, a very, very large hue of the frontal sinus glow, and that indicates that the patient is completely free of fungus inside. And we had already seen on the CT scan in the original surgical video that this patient had a very, very huge right side frontal sinus. You can see the frontal sinus is also extending onto the left side, and the left side frontal sinus is very small. So you can see two bright spots on this second image right now. The lower one near the medial canthus of the eye is the place where the tip of the endoscope is present, and the bright spot above that indicates the place where the light is being hit on the bony wall of the sinus. And the rest of the light is just the reddish hue of the frontal sinus, a diffuse light inside. That's the third photograph. You can see a brilliant, brilliant illumination of the frontal sinus that indicates that the surgery was a huge success, and the patient is free of fungus right now. So I'm going to shift on to the fourth photograph, and that is the yet another photograph showing the frontal glow sign very clearly. So this is a fourth photograph under bright light from above, and you can see the bright reddish frontal glow sign inside the patient's right frontal sinus. And you can see the endoscope from the right nasal cavity entering inside.